Bon Secours is celebrating a big milestone this month, and it's kind of appropriate that it falls during Breast Cancer Awareness Month. The 10th anniversary of the St. Francis Cancer Center. Here to talk about it, we have Bon Secours oncologist Dr. Stephen Dyer. Thanks for joining us.
Thanks, Megan.
Good to see you here.
Likewise.
Let's talk about it. You know, a lot can happen in 10 years. How have you seen this program grow since the facility first opened?
You know, it's really amazing. I tell my patients all the time that I practice oncology very different now than I did 10 years ago. A lot of the new agents that are out there, the new medicines. But you know, it's funny because we've also had the opportunity to grow as a program during that time. We've, over that time, even though we've been in the same physical space, we've increased our volume by 4 times. So we're 4 times bigger than we were before. That means we have so many more patients that are coming through. We've also increased the amount of providers that we have, the number of doctors that we have, and the number of services that we offer to patients during that time.
Talk about exactly what kind of services you offer at the building and what goes on there.
Yeah, so we really designed the building to be sort of comprehensive cancer care for patients after their diagnosis. So a lot of our patients go and have mammograms or colonoscopies in other places, and then once they're diagnosed, they come to us. I'm a medical oncologist, which means I'm a chemotherapy and other systemic therapy doctor, but we also do radiation therapy, and then all of our support services are under that roof as well. So things like palliative care, nutrition, education services, those are all there under that one roof, and we wanted to make it easy because before that, patients were having to travel all over the city.
And I was going to say, explain why that. Anyone that, you know, ever got the unfortunate diagnosis of cancer, you know how important it is. You've got a lot of appointments. To have it all right there, it's got to be just a little bit easier.
Absolutely. And you know, we do have some patients who are getting, for example, chemotherapy and radiation therapy at the same time. And for those patients to have an infusion across town and then have to come for radiation, which is often daily, was just a challenge that was too much for us to ask of our patients. Not only that, but we also have treatment navigators that are based out of the cancer center that also can help patients coordinate their care. Much easier on them, much easier on patients to have it all under one roof.
Yes, and it's so nice that you offer the navigator, because it is. You wouldn't think there'd be so many, but there's so much to consider.
Absolutely.
A lot. Okay, let's talk about, you know, the screenings, because we talk a lot about, you know, prevention, but sometimes, you know, like the screenings. Talk about how that goes.
Yeah, so screening is very important to us as oncologists because that allows us to take better care of patients once they're diagnosed. Instead of being diagnosed at a later stage where they're more likely to need things like chemotherapy or radiation, a lot of times patients who are screened and detected early can actually have just a surgery or just a minor procedure, whereas it may be a lot more invasive or a lot more involved if it's later. The other thing that we have really been focusing on is we're trying to get it off the ground actually in the next few months. A clinic for lung nodules specifically. We know we have a lot of folks who are former smokers in our community, and those folks are at higher risk for developing lung cancer.
Yeah.
So we typically think about screenings for colon cancer with colonoscopy, mammograms for breast cancer, but screening for lung cancer is becoming increasingly important, especially in our community. So Bon Secours is rolling out this program in the next few months to actually take care of our patients who are current or former smokers and continue to identify folks early so that their lung cancer can be treated successfully.
Oh my gosh, because that's one of those you hear and it's like, gosh, if this could have been caught earlier, it would have been so different. How do you keep up with like all the screenings too? Because I know it's like, okay, mammograms 35 or 40 if there's colonoscopy 45. You know what I mean? I feel like the numbers change.
It does change, and that's the importance of having a great primary care doctor. You know, we obviously do the treatment for folks after they've already had their screenings, and so we do have some patients for whom we're encouraging screenings, but to be quite honest, most of the time that's already done before they even make it to the cancer center. And so making sure you're really plugged in with your primary care doctor, asking for appropriate screenings. Some of that may even involve blood tests depending on the situation. And so, but obviously things like mammograms, colonoscopies now with the lung nodule screenings, these are things that are procedures that are just vitally important for our patients.
And you shouldn't have to like push for that. You do, you know what I mean? That's why you got to have that good relationship with, you know, with that doctor, that primary care. And y'all have got some fantastic ones that you can look at.
Yes, we do.
If people are watching and maybe they are not a part of the, you know, Bon Secours family, but they're like, gosh, I need to get that screening. How does that work?
Yeah, so actually for our mammogram program, for example, you don't even need a doctor's order. So that's something they can just call the Pearly Harris Breast Center to get plugged in there. Some of the other screenings that are a little bit more involved, like colonoscopies or the lung nodule screenings, you will have to talk to your primary care doctor. But if you already have a Bon Secours provider, then it should be easy to just have a discussion with them. If you're not, please call Bon Secours. Get established with primary care. That's a tremendous asset.
Yes, and the Pearly Harris Center, what a treat that is that we have it right here. They make it, you know, everyone's always like, oh gosh, I got to go do the mammogram. They make it as enjoyable as it can be and as easy with all the stuff.
For sure.
So thank you so much, Dr. Dyer.
Absolutely. Thank you for having us.
We appreciate you here. Listen.